You saw the headlines, and in the last 48 hours you did one of two things. You got alarmed, started thinking about the garage, the storage unit, the cabin you're about to open for the summer. Or you dismissed it. City person. Not a farmer. Doesn't apply to me. Both of those reactions will leave you more exposed than before you clicked. Not more scared. More exposed. And that's a different problem. Here's what almost nothing you've read is telling you. The danger with this virus isn't crowded spaces or infected people. It's a garage that's been closed since October, a storage unit you haven't opened since last fall, a cabin sealed all winter. And the reason those spaces are dangerous is that there is no warning signal when it happens. No smell, no colour, nothing your body registers. The entire exposure is invisible. That's what I call the invisible exposure problem. By the time this video is over, you're going to know exactly what it is, who it actually affects, and, most importantly, a specific phrase that most people will never know to say. A phrase that, if you ever need it, can change what happens to you in an emergency room. First, the foundation. Hantavirus is not a mystery virus. It has been on our radar since the early 1950s. We understand its biology, its transmission, its clinical presentations. A known virus isn't automatically less dangerous, but it is understandable. And what's understandable can be managed. Most people, when you ask them how hantavirus spreads, describe it like COVID, person to person, shared indoor air. That mental model is completely wrong, and wrong in the exact way that creates real vulnerability. There is no person-to-person spread with hantavirus. None. You cannot catch it from someone who has it. The reservoir is rodents. Infected rodents shed the virus in their urine, droppings, and saliva. When those materials dry in an enclosed space, the dried particles become suspended in the air, not through anyone's breath, but through the simple act of disturbing a contaminated space. Let me make that concrete. Your husband, your father, or you opens the garage for the first time since November, steps in, starts moving boxes, lifts a cardboard box near the wall, doesn't see anything unusual, no smell, maybe a few small droppings he barely registers, no colour in the air, no sensation in the throat, nothing. He spends 40 minutes in there, goes inside, washes his hands, has lunch. That is the invisible exposure problem. The particles were real. The exposure was real. And there was no sensory warning available at any point in those 40 minutes. So what do you actually do? 3 steps. Step 1, ventilate before you enter, open every window and door you can, and let the space air out for at least 30 minutes before you go in and start moving things. That single action changes the particle concentration dramatically. It costs you nothing. Step 2. If you see evidence of rodents, droppings, nesting material, gnaw marks, do not sweep, do not vacuum. Anything that stirs those particles into the air defeats the purpose. Put on an N95 respirator. Mix a bleach solution, 1 part bleach to 10 parts water, and dampen the contaminated area before you touch anything. That inactivates the virus and binds the particles. Wear disposable gloves. Seal everything in a bag. Take it directly outside. Don't handle the bag again. Step 3 is the one people think they can skip, until they can't. Here is what hantavirus does inside the body. I'm going to slow down here on purpose. Production note, infographic on screen, disease timeline, 2 columns. Left, Hantavirus Pulmonary Syndrome, HFRS, North America. Right, hemorrhagic fever with renal syndrome, HFRS, South America, Asia, Europe. Timeline, days 1, 5, days 5, 30, 10, late stage window. Hold through this section. Phase 1 looks exactly like the flu. Fever, deep muscle aches, not soreness, significant aches. Fatigue, 3 to 5 days. Most people assume it's the flu and wait it out. Then comes the shift. The lungs begin to fill with fluid, not over weeks, rapidly. The respiratory deterioration in HPS can accelerate within hours. A person managing their symptoms can move into severe respiratory failure faster than any standard flu progression would suggest. The case fatality rate for HPS, approximately 38%. Production note, infographic, mortality rates appear on screen. Hold. For hemorrhagic fever with renal syndrome, mortality approaches 50% in some strains. I'm not going to soften those numbers, but I need to put them next to the second number immediately, because without it, fatality rates are just fear. Hantavirus infections in the United States, somewhere between 20 and 40 confirmed cases per year, sometimes fewer. The virus is genuinely dangerous once it infects, and genuinely rare at the population level. Both of those facts are true at the same time. What determines which one is relevant to you is your specific exposure context. The populations at genuinely elevated risk, agricultural and construction workers, especially in rural settings, forestry workers, anyone with rural properties, cabins, outbuildings, seasonal structures, anyone who stores grain or feed. If none of those describe your life, your picture looks meaningfully different. If one of them does, the protocol I just gave you is not optional information. One more thing that belongs in this conversation. What your body can do when exposure happens matters as much as whether exposure happens. 3 things I see consistently in men over 50 that compromise immune function without getting enough attention. Sleep. Chronic sleep deprivation impairs immune response at the cellular level, full stop. Vitamin D deficiency, genuinely common in this age group, genuinely documented in immune regulation. A simple blood test tells you where you stand. And visceral fat, not an aesthetic issue, a functional one. Metabolically active tissue that produces inflammatory signals around the clock, which alters how your immune system responds when it faces a real challenge. Now, the single piece of information I think matters most in this entire video. If you develop fever, significant muscle aches, and progressive shortness of breath, and those symptoms arrive within 1 to 8 weeks of any potential rodent exposure, go to an emergency room. Not urgent care, not a nurse hotline, an emergency room. And when you get there, say these exact words. Write them down if you want to. I may have had exposure to a rodent-contaminated space approximately X weeks ago, and I want to rule out hantavirus. Most people will walk into that ER describing a fever and shortness of breath, and a physician will work through the standard differential, flu, pneumonia, COVID. That is completely reasonable medicine. But without those words, hantavirus stays low on the list. It's rare enough that it won't automatically come to mind. With those words, everything changes. The imaging changes. The labs change. The urgency changes. That sentence is the difference between a standard workup and a targeted one. With a 38% fatality rate, the speed and specificity of diagnosis is not a secondary detail. It can be the whole outcome. This is the piece that doesn't make it into any headline. I'm telling you because that's the conversation a physician has with a patient when there's time to have it properly. And most of the time, there isn't. The invisible exposure problem is only invisible to the person who doesn't know where to look. The man in that garage, if he knows that sealed spaces with rodent activity carry real risk, he ventilates first. He wears a mask if there's visible contamination. The exposure that was invisible to him becomes something he can see, assess, and address. That is what accurate information does. It doesn't eliminate risk. It converts the invisible into the visible, and the visible into something manageable. Panic gives you elevated cortisol and no change in behavior. Dismissal gives you short-term comfort and no change in behavior. Awareness, grounded in the actual mechanism, gives you something neither of those does. The knowledge to act where action is warranted, and the genuine reassurance to let go of fear where it isn't. So here is my real question. Is there an enclosed space in your life you haven't been in for 6 months or more? A garage, a cabin, a storage unit, a shed? Think about it right now. not with alarm, with clarity? Tell me in the comments, because knowing how real people are processing this is exactly how I decide what to cover next.